Psychoeducation serves central key functions in CBT. The main purpose is to inform children and their parents about anxiety, sources of anxiety, symptoms of and common reactions to anxiety, and treatment approaches. This knowledge normalizes the client's experience of anxiety and empowers them to deal with anxiety in an optimal way. When clients learn factual information about anxiety, misinformation is dispelled and children and parents learn that others have faced similar challenges. As well, providing information on the effectiveness of cognitive behavioral therapy gives clients a sense of hope. The crumpled paper throw game is an active and engaging approach to psychoeducation, and thus it maintains children's interest and helps them to absorb the material. The practitioner explains the game as follows. Crumple a piece of paper into a ball, stand behind the tape line and throw the paper ball toward the hoop I will make with my arms. If you get the crumpled paper through the hoop, you earn 1 point. If you miss, I will ask you a question. You get 2 points for each question you answer correctly. If your answer is incorrect, I will read the answer to the question and then you will have the chance to answer again and earn 2 points. At the end of the game, trade in points for prizes. 1 to 10 points, 1 prize, 11 or more points, 2 prizes. The questions define anxiety, psychological responses to anxiety, and the process and benefits of CBT. Example of questions include:
What is anxiety?
Anxiety is a feeling of worry or nervousness. Everyone gets anxious or worried sometimes. When kids worry a lot, it can be hard for them to feel happy and enjoy certain activities. Kids need help for anxiety when they worry much of the time, and when their fears or worries stop them from having fun or from doing normal activities.
True or not true? Some anxiety can be helpful.
True, anxiety can actually be helpful because it can protect people from real danger. For example, if you're crossing the street and a car comes fast toward you, anxiety would alert you to this danger so you can get out of the car's way.
What does anxiety feel like in the body?
When you feel anxious or worried, you might get a short tummy or have diarrhea. Your body might get hot and sweaty. You might feel dizzy or shaky or even feel like you're going to throw up or faint. Your heart might pound really fast and you might have a hard time breathing. Therapy can help you learn ways to handle anxiety so your body doesn't feel so bad.
What is cognitive behavioral therapy?
Cognitive behavioral therapy, or CBT for short, is a type of therapy to help people with anxiety. In CBT, kids learn special skills to help them cope with worries and fears. CBT proven to be the best way to help kids deal with anxiety.
What is gradual exposure?
Gradual exposure is part of CBT. Gradual exposure involves facing a fear a little at a time until the fear is not so scary anymore. Don't worry, we will only start this part of therapy when you are ready. We will make a plan together so you feel okay with it. After a while, your anxiety will lessen and you will feel calmer and better.
True or not true? The goal of therapy is to make anxiety go away.
Not true. Remember, some anxiety is normal and helpful, so we need a certain amount of anxiety. The goal of therapy is to help kids handle fears and worries so anxiety does not stop them from having fun or from doing normal activities. Parents play the game along with the child so they can learn together. Presumably, clients will not know the answers to many of the questions. However, they have the opportunity to learn the answers when the practitioner reads them aloud and can then earn points for providing the correct response. This approach encourages children to listen attentively when correct answers are read aloud and facilitates learning and integration of the material. Optional questions can be added to the game that define specific anxiety disorders. For example, what is selective mutism? What is a phobia? Movement exercises are integrated into the game to make it more active and engaging and to teach relaxation skills. For example, do the shoulder crunch by scrunching your shoulders up to your ears, then relaxing them and moving them around 5 times. An important aspect of gameplay is points of departure, in which psychological issues raised during the game are explored and discussed. The therapist must manage and guide discussion back and forth between the safety of the game and the realistic discussion of issues through points of departure. For example, in relation to the question true or not true, some anxiety can be helpful. The therapist can self-disclose a time that anxiety was helpful, then ask the client to share an example. Somatic management skills training. Relaxation training helps anxious children develop awareness and control over their own psychological and muscular responses to anxiety. One of the most commonly used and effective relaxation skills is diaphragmatic breathing. Children who are highly anxious are often resistant to relaxation. This may be due to a pessimistic mental assessment. For example, this won't work, or extreme feelings of fear that prevent them from relaxing. Teaching children to relax using playful techniques is often an effective way to break through the resistive barrier. An engaging intervention that can be used to teach diaphragmatic breathing is the cookie breathing game. Children are instructed as follows. Put your hand on your tummy where your belly button is. Slowly breathe in through your nose for 3 seconds and feel your tummy move out. Slowly breathe out through your mouth for 4 seconds and feel your tummy move in. Make sure your shoulders and chest are relaxed and still. Only your tummy should be moving in and out. To help you learn this special way of breathing, imagine a yummy batch of cookies that just came out of the oven. As you breathe in, smell those yummy cookies. But they are hot, so you have to blow on them to cool them down. As you breathe out, blow on the cookies to cool them down. A game is then played to help the child practice. The child rolls the dice and does cookie breathing 2 times when an even number is rolled. The child gets a point when an odd number is rolled. The child gets a cookie once 4 points are earned. Cognitive restructuring. Children with anxiety have negative, irrational, or unhelpful thoughts and beliefs which lead to heightened feelings of anxiety. Helping clients to understand the connection between thoughts, feelings, and behaviors and to replace unhelpful, anxious self-talk with helpful, calming self-talk are key goals in cognitive behavioral therapy. Learning cognitive coping can be an abstract and dull task for children. Hurtful thoughts is an intervention that enables practitioners to use a developmentally sensitive and experiential method to connect cognitions, affect, and behaviors. Further, it is a non-threatening way of helping children challenge and correct their maladaptive assumptions. A step-by-step demonstration of helpful thoughts activity can be found on the author's YouTube channel. The practitioner can watch this YouTube video along with their clients. Teaching CBT skills via YouTube videos offers considerable intuitive appeal. Most children are familiar with YouTube and are likely to find this method of instruction quite captivating. Moreover, using a YouTube video involving another child to teach CBT skills incorporates the principles inherent to observational learning and offers the opportunity for a child to model the skills. Exposure. Gradual exposure is a cognitive behavioral intervention designed to gradually overcome dysfunctional avoidance and thereby allow the child to regain optimal functioning. Exposure is a critical component in cognitive behavioral therapy for anxious children. Facing fears is a difficult experience for children, and as such, many clients are reluctant to proceed with this phase of therapy. The key to engaging children in the exposure process is to build client readiness by channeling the desire to get well into the action to get well. The Picture It poster presents exposure in a developmentally appropriate manner. The first part of the activity focuses on building client readiness and motivation to face fears. This is accomplished by explaining in child-friendly terms the rationale and benefits of exposure and initiating a reward system. The second part of the activity guides the child to develop a series of graduated exposures. The child, parent, and therapist collaborate to develop exposure exercises. This empowers the child to take charge of overcoming fears. The child creates a poster with drawings of the exposure exercises. This makes the exposure plan more concrete and manageable. The practitioner offers input to ensure each step on the exposure plan is specific and doable, and that the steps are ordered in an appropriately graded manner. The parents must be provided with ample guidance on ways they can support the child during the implementation of the exposure plan. There are many helpful sources available for parents such as Chansky, Pincus, and Wagner. Relapse prevention. Relapse prevention is a key focus in the final sessions of therapy. An important goal is to prepare children and their parents to expect anxiety from time to time and to emphasize that continued practice and use of skills learned in therapy can assist in dealing with setbacks. Relapse prevention also entails presenting children with challenging scenarios that they might encounter in the future and helping them to problem solve appropriate ways of managing potential fears or worries. The Coping with Anxiety envelope game was created with these goals in mind. The therapist places scenarios in envelopes and instructs the child as follows. Roll the dice. If you roll an odd number, you get 1 point. If you roll an even number, pick an envelope, open it, and answer the question. You get 2 points for each question you answer correctly. At the end of the game, trade in points for prizes. 1 to 10 points, 1 prize. 11 or more points, 2 prizes. The scenarios can be tailored to the client's age and circumstances. Examples include: you wake up from a nightmare and feel panicked. Circle the best way to cope with this. A. You should think to yourself, I can't handle this. B. You should run to your parents' bedroom crying. C. You should do deep breathing until you feel calm. You should also regularly practice the relaxation strategies learned in therapy so you can remember them and can use them when you need to calm your anxiety. You worked hard in therapy to overcome your fear of bees. You are outside playing and you get stung by a bee. Now you're afraid to go outside. Circle the best way to cope with this. A. You should think to yourself, therapy was a total failure. B. You should do some of the steps on your picture with poster to gradually face this fear again and get yourself back on track. C. You should never go outside again. The game keeps the child engaged in the process, facilitates problem solving, and encourages the continued use of skills learned in therapy. What are nonspecific factors and why are they important to cognitive behavioral therapy? CBT is structured and goal-directed. The context is supportive and the techniques are paired with a collaborative therapeutic stance. Nonspecific factors refer to the relationship components of therapy and can be compared with specific factors that refer to the technical aspects of psychotherapy. Nonspecific factors are common within all psychotherapies and serve as the foundation for patient improvement. Specific factors refer to intervention techniques unique to the type of therapy being provided, for example, CBT, psychodynamic, interpersonal. Studies show that nonspecific factors are responsible for a large percentage of the change associated with psychotherapy treatments. When nonspecific factors are critical during the early stages, but important at all phases of treatment. Strong nonspecific factors aid in engaging and retraining patients in psychotherapy and also strengthen the technical components of treatment. Patients who perceive the therapeutic relationship to be collaborative, safe, and trusting are in a better position to obtain benefit from the treatment while likely be less resistant and will be more open to exploration and change. As treatment progresses, the therapeutic relationship should become stronger, allowing the therapist and patient to gradually move into more complex and meaningful therapeutic issues. How? Borrowing from person-centered therapy, this model focuses on 3 factors important to the development of a strong therapeutic relationship. These factors are empathy, genuineness, and positive regard. These concepts are defined and discussed but represent general characteristics that all therapists should seek to attain in working with patients. Following a discussion of these principles, the concept of active listening is introduced as a technique to better attain a solid therapeutic relationship. Empathy is the ability to understand experiences from other person's point of view. Empathy is an important part of building rapport and facilitates feelings of trust and mutual respect between the patient and therapist. It is necessary for the therapist to consider the concept of multifunctional empathy, which relates to understanding persons from other life backgrounds. It is impossible for a therapist to be knowledgeable about every patient's unique background. Empathy, which at its core consists of asking questions in a respectfully curious manner and expressing emotional understanding of the answers received, is a solid first step towards understanding patients' unique life background. Additional reading about cultural differences may facilitate more informed questions and better prepare the therapist for additional questions and/or report development. Ultimately, the therapist has an added task of learning about the culture of patients and appreciating life from their perspective. Showing empathy to a patient helps to validate his or her experiences. Being critical, even subtly, of what a patient is sharing in therapy often makes him or her feel judged or unwilling to disclose additional information. Use validating responses to show empathy towards a patient. Validating responses are simply statements of understanding of your patient's viewpoint. Validating responses usually entail the therapist describing what he or she heard the patient say. Genuineness. Genuineness is the ability to be authentic and free of dishonesty or hypocrisy. You can be professional and express who you are at the same time. Genuineness helps build rapport and solidify a therapeutic relationship by allowing the patient to view the therapist as a human being. It also allows patients to access the genuineness of the therapist for credible critical feedback about progress in their functioning. Genuineness consists of a wide variety of concepts ranging from nonverbal behaviors to overt statements. Examples of factors related to genuineness include: supporting nonverbal behavior includes behaviors like keeping eye contact, giving a patient your full attention, and nodding in agreement or understanding. It is important that these nonverbal behaviors match what is going on in the conversation so as not to seem unnatural or fake. Role behavior. CBT therapists encourage patients to be active and empowered and subsequently attempt to facilitate this development through their behaviors in therapy. Therapists that stress their authority in and between sessions with patients can cause a patient to feel inferior or intimidated. It is important to remember that the therapeutic relationship is one of partnership and that the therapist and patient work together to alleviate concerns, fears, and problems in the patient's life. Conquerance. Making sure that your words, nonverbal behavior, and feelings match each other is referred to as conquerance. Not demonstrating congruence of your feelings and thoughts can become confusing or misleading to a patient. Spontaneity. This concept deals with the way the therapist speaks and the timeliness of responses. Responses and feedback provided in the moment are more valuable than feedback provided at a later time. Patients are more likely to receive spontaneous messages as genuine. Positive regard. Positive regard simply means showing all patients the respect they deserve. It's essential to show the patient that he or she is valued and that what he or she has to say is important. Patients who feel that their thoughts and feelings are acknowledged and understood often share more and feel more connected to the therapist and the therapeutic process. Communicating positive regard may be harder than it seems, especially if you hold some negative beliefs about the person you are trying to help, which can be a common experience for therapists. Sharing any negative feelings or beliefs about your patients with your supervisor or consultant can be an excellent method to ensure that you develop and demonstrate genuine positive regard toward your patients. Commitment to the patient means that you are dedicated to working with the patient on whatever issues he or she is bringing to therapy. This includes being on time, avoiding cancelling the patient's appointments, and using all efforts to help the patient through work those issues. Having a non-judgmental attitude towards the thoughts, feelings, and actions of the patient is essential. It is possible to accept and understand a perspective without necessarily agreeing with it. Displaying warmth towards patients is a vital part of building rapport. Warmth can be displayed through tone of voice, facial expressions, and body postures, or the thoughtfulness of your responses. The following section addresses the concept of active listening. Active listening is a useful technique to communicate to non-specific factors of empathy, genuineness, and positive regard. Active listening. Listening to your patients is the foundation of all therapeutic approaches. Listening is made up of 3 steps: receiving a message, processing it, and sending it back. Therapists should attempt to remain open to all messages from their patients, both verbal and nonverbal, and attempt to process as many messages as possible. Since we all speak from our own frame of reference, messages we send to others may not be received in the way we intended. Clarification is a useful and necessary tool for all therapists. Clarification can be used to help simplify a message that is being sent by the patient, or to help confirm the accuracy of what the therapist thinks he or she understood. Paraphrasing and reflection. These techniques involve restating the patient's main thoughts in a different way, or reflecting back the emotions the patient is currently experiencing to gain depth or clarification. Listening for themes and summary statements. Often, patients express thoughts, feelings, and behaviors that become thematic across situations. Although novice therapists may initially have difficulties identifying this thematic content, repetition over time usually helps to create a clear picture of the salient therapeutic issues that require attention or focus. With experience, therapists become more effective and efficient at identifying thematic content. Once identified, thematic content can be a very powerful mechanism to influence treatment outcomes. Summarization is the technique that brings thematic content into the purview of the patient. Summarization is a condensed phrasing of the patient's responses over a specific period of time. You should rephrase the themes and repeat them back to the patient for clarification. Barriers and challenges to building an effective therapeutic relationship. Setting limits in an empathetic manner is an essential tool for new therapists. Many new therapists desire to make it all better in that they may cuddle and console the patient and are distracted from working on deeper issues. A therapist can create a holding environment through empathetic words and active listening. A holding environment is a setting in which the patient feels like he or she is being heard and that he or she is in a safe and secure place to voice thoughts and feelings without judgment. Moving from rapport and relationship building to assessment and goal setting can be challenging. When therapist and patient are on the same page, this transition appears seamless. Often, however, patients and therapists are not speaking the same language. For example, a therapist may feel most comfortable when tackling a certain issue first, whereas a patient may wish to focus on a different problem first. When the therapist and patient are not in a congruence regarding goals, the move between rapport building and goal setting is strained. To overcome this issue, therapists are encouraged to use motivational interviewing strategies. Primary techniques involve listening to the patient, following the patient's lead and/or motivation, and setting collaborative and mutually agreed upon goals. A vital aspect to transitioning from rapport to goal setting involves assessing the importance, confidence, and readiness of the patient about specific treatment goals.